is that time of the morning and that time of the month, really. We're heading to our Zoom this morning. We're Zooming in. We like to do this. Our resident naturopath and nutritionist, Kelli Kieselbach, is joining us this morning. Kelli, good morning to you.
Morning. How are you?
I'm going really well, thanks. How's things where you are? How was Christmas, New Year, and all that kind of stuff for you guys?
Oh, yeah, it was great, actually. Very relaxed. Very nice. Just chilling out at home.
Yep, nice. Well, look, it's great to have you back on with us, and looking forward to the rest of our time with you in 2024. Now, this morning, and I have mentioned this a few times on air during the week before in the lead up to today, pretty big topic this morning. Now, we will be talking a little bit about COVID, but we've got a bit of a little bit of a twist to it, more of a specific sort of area. But before we jump into that, can you just give us a little bit of an idea about what is long COVID? A lot of people have heard about that.
Yeah. So long COVID is a term given to having an ongoing symptoms after the acute infection of COVID has finished. Typically, those symptoms need to have lasted for at least 12 weeks or longer. They're basically the acute infection resolves, they start to feel better, can go back to work, but then they still have these lingering symptoms, or they might develop new symptoms as a result.
Yeah, right. Now, and how common is it? Because I know a couple of people who are actually suffering from that. So what are the stats like on that?
Well, the Australian stats, I think we've settled on about 10% of people who experience, contract COVID will end up with some lingering symptoms. There's different numbers from different places around the world, but I think 10% is the most common number that I've seen.
Yeah, right. And what is it about it that makes some people, I guess, more susceptible to having long COVID?
Yeah. So we don't 100% know, but it seems to be more of a risk in people who have pre-existing chronic conditions or underlying, even just low-grade inflammation that they're kind of, teetering on the edge, and then, they get COVID and it kind of just flares them up and sets them on a trajectory for long COVID.
Yeah.
It is more common in females, and this is actually consistent with other post-viral illnesses that we've seen, because long COVID's new, but post-viral illness is not new.
Sure.
We do see more commonly in females, and with long COVID, particularly in middle age, seems to be more of a risk. But in saying that, I have a lot of clients who are, in their 20s and 30s, or, in their latter years as well. So it's really non-discriminatory.
Wow. Yeah, that's definitely interesting for sure. Now, what different areas of the body does it affect, or at least what are some of the most common symptoms that you're seeing?
Well, it's a whole body condition. So it affects every system in the body, because that virus can infiltrate pretty much every tissue in the body. For me, in my clinic, one of the most common symptoms I would definitely have to say would be ongoing persistent fatigue and also brain fog. So there's difficulties with memory, concentration, focus, that feeling of cotton wool in your head, and also mood issues. So a lot of new onset anxiety. So people have never had anxiety or depression before, all of a sudden are having issues with that, or worsening of pre-existing mental health issues as well. And then I would say, there's muscle and joint aches, headaches and migraines are very common, and what we call dysautonomia, which is where there's a dysfunctional response in the autonomic nervous system. So the autonomic nervous system controls all your involuntary actions, like your heart rate and your breathing. And so people can have issues with, sudden blood pressure drops, or, palpitations and heart rate issues as well. And probably the thing that sets long COVID apart from other post-viral issues is that people can have that really ongoing persistent cough or lung damage, chest pain. Those symptoms are probably a bit more specific to long COVID, but not everyone with long COVID will have them.
Yeah, wow. Now, what's the recovery rate like? Because I guess people out there listening in this morning are thinking, obviously COVID I think there's supposed to be another wave at the moment. I'm not real sure. I don't really keep up
Yeah,
with it anymore. I mean, I think once I got it
bit hard to
myself last
tell.
year for the first time, I was like, whatever. Okay,
Yeah.
it's here and it's going to be here forever, pretty much. So, but yeah, what are you seeing there? The recovery rates?
Look, it really depends. It's a condition that is so unique to the individual.
Hmm.
How someone experiences it, how severe it is, how long it takes them to recover, or if they recover, is really variable from person to person. So, how long's a piece of string, really? They do say, and then the literature suggests that people who recover sort of within that 12-month period have a much better prognosis in terms of being able to maintain their recovery. Once it kind of gets past that 12-month mark, is starting to move into that chronic fatigue syndrome sort of picture, which is a post-viral condition that's been around for many years.
Yeah, absolutely. We are talking with our resident naturopath and nutritionist Kelli Kieselbach on the line this morning. We'll take a short break, and we'll be back right after this, having a little bit more of a chat about long COVID, but particularly how it affects the digestive tracts. This is Rhema Brekky. Stay with us. It's 20 and a half minutes after 8. Rhema Brekky. On your Friday morning, we are joined on the line with our resident naturopath and nutritionist Kelli Kieselbach is in the chair with us. And look, we were chatting before about long COVID. It is a bit of a prevalent thing in the community as well. Kelli was saying before, up to around 10% of people who've had COVID, the infection itself, now struggling with long COVID. But we wanted to have a bit of a look at something a little different with long COVID this morning. And Kelli, so how does long COVID affect the digestive tract?
Yeah, so with COVID, so one of the ways that COVID gains entry into the body tissues is through what we call these ACE receptors. And the digestive tract is very, very rich in these ACE receptors, which allows the virus to take hold there. And we know that the virus can be present within the digestive tract for weeks or months after the acute infection has resolved. So with that, that can it causes an alteration or a change in the balance of the bacteria within the gut, which has huge implications for us health-wise. And it can also increase localized inflammation in the gut, which then has a widespread impact to the rest of the body. And there was a study done in the UK recently looking at the outcomes of people with who've had COVID and go on to have long COVID, and they're showing that they have an increased risk of certain digestive issues as well.
Yeah, because it's not something that you would, I guess, if you're thinking COVID, that you would, I guess, automatically associate with your gut, really.
Yeah, well, that's right.
Because everybody seems to be talking about the regular symptoms, I guess, the cough, the headaches, the fever, all of that kind of stuff. But with the digestive tract, that is definitely a different one for sure.
Yeah, and some people do have some digestive symptoms with their acute infection. So it's not uncommon to have a bit of nausea, a bit of diarrhea. But that's not common for everyone.
Sure.
But certainly it can long term. We see these alterations persisting long term in a lot of people.
Yeah, so those symptoms that I guess where it's more affecting the digestive tract, what do some of those look like?
Yeah, so really those irritable bowel syndrome type symptoms. So the most common ones seem to be, chronic constipation, reflux is a big one, and alternating, diarrhea, stomach pain, bloating. So those kind of functional symptoms. There also has been reported more issues with liver and gallbladder as well. So, that can be impacted as well.
Yeah, interesting one for sure. Now, how can naturopathy and nutritional treatments help?
Yeah, well, I think nutrition and naturopathy are really well placed to try and support someone with long COVID because we are about treating the whole person, the individual, and looking at what that individual really needs, and also trying to address some of those underlying drivers so that we can have a downstream effect on the symptom picture. So some of those would be by improving inflammation, because we know that inflammation doesn't quite resolve in long COVID
Hmm.
properly. So we would use diet and anti-inflammatory herbal medicines, some which have been now studied as well in some of these conditions to reduce the inflammation. Things like fish oil, turmeric, um, also by helping to support and protect the mitochondria and the small blood vessels. So the mitochondria are the little batteries in our cells that help produce energy.
Hmm.
And these are really, really vulnerable whenever we have a viral infection. And so looking after those, providing it with the nutrients that it needs, and also looking after the small blood vessels as well, because we know that there is some sort of change that happens in the small blood vessels, which means oxygenation is affected as well. And so using antioxidants, and particularly there's a specific type of antioxidant called polyphenols, and these are rich in cocoa and berries and garlic and green tea. And these have been shown to have a positive impact on people with long COVID in improving their fatigue and other symptoms as well. And then looking after the digestive tract. So we can start to manipulate the diet and support with prebiotics and probiotics to help restore that balance
Hmm.
and reduce any inflammation in the gut, which can alleviate some of those symptoms. And that will have a flow-on effect to what's going on in the rest of the body as well. So, and
Yeah.
then I guess the last thing would be that we know that happens in long COVID is this change in nervous system function, and there's change in the way that we respond to stress. And herbal medicines can be really, really useful here. And there's a few studies. One of the silver linings of COVID is that we've had a lot more studies on post-viral issues and some of these key herbal medicines and nutrients. And so there was a specific study done on a couple of key herbal medicines, rhodiola and Schizandra and Eleutherococcus, that showed that it improved people's fatigue after COVID infection. So there's quite a few ways that we would support someone with long COVID,
Yeah.
and we would really get right down to the nitty gritty about what is good for that individual and what's the priority for them, to support them.
That's cool. Now, what sort of information is available out there for people if you want to know more about long COVID? I know we were talking off air before that can be tricky sometimes here in Australia because we don't really have the big university hospitals like they do either in the UK or the US, in particular with a lot of the broader range studies happening. But
Yeah.
how can we go about that?
Yeah, so in terms of what the Australian government provides, you can go to the Australian Institute of Health and Wellness site. They do have some information on long COVID in Australia, and they've got some stats and some basic information there. You can, as you said, do a quick Google search, things like the Mayo Clinic. There's also in the UK a lot more information coming
Hmm.
out about long COVID, and probably hooking into some support groups.
Yep.
There's on Facebook, there are quite a number of support groups or information channels now coming through social media. I would caution to be careful about any information regarding treatments. Like,
Sure.
always get professional advice, because some of it's great information and some of it's a bit sketchy or
Yeah.
not well founded yet. Um, and I do have a lot of information on my social media pages as well regarding post-viral issues and long COVID. So if people want to find out a bit more specifically about nutrition and how naturopathy can support long COVID, you're more than welcome to go and browse through
So
my Instagram and Facebook.
where can people find you?
Yeah, so on Instagram, it's Kelli K, so Kelly with an I, K underscore naturopath, or on Facebook, Kelli K Health. Or you can find links to my social media and my blog through my website, which is Kelli K, so KELLIK.com.au as well. Mm.
Brilliant. Brilliant. Thank you so much for joining us this morning, Kelly. It's always a pleasure. Look forward to the rest of 2024 with you, digging into some other great topics. You hold the line. I will get back to you very, very shortly indeed. This is Rhema Brekky here on your Friday morning, and of course, stay with us. It's just amazing how quick the morning has gotten away from us, because it's one of the things I love to do when I get people like Kelly on the air with us. We just love to go and have a great old chat about things. So again, if you want to just give us those details again, please, Kelly, that would be fantastic.
Yeah, absolutely. The website is kellik.com.au. And Instagram, KellyK_naturopath, or Facebook, Kelly K Health. And you are welcome to get in touch with me by email or message as well, but via those means as well.
Brilliant. Thank you so much, Kelly. Stay with us. This is Rhema Brekky on your Friday morning. We'll be at 8:30 news next.